Welcome to the Vitreoretinal Emergency Unit at Moorfields. We have created this video in the hope of improving your experience and aftercare following your retinal detachment surgery. The aim of surgery is to reattach the retina and to save further vision loss. The main ways in which we repair the detached retina are as follows. Vitrectomy, insertion of gas bubble, and cryopexi. This is the most common way that we repair detached retinas. The vitreous gel is removed using tiny instruments, and a bubble of gas or air is inserted into your eye to hold the retina in place. Cryopexi is freezing the area of retina to help it to reattach. Scleral buckling. In this procedure, your surgeon fits and secures a piece of silicone or sponge onto your sclera. This is the tissue that you know as the white of your eye. The buckle pushes into your eye and indents it. This pushes your retina back into the tissues that normally support it, so it can reattach. Factors in deciding which type of surgery you have include what condition your vitreous is in, whether or not you have your natural lens or an artificial lens implant, and whether you are able to hold your head in a certain position following your surgery. Your surgeon will explain to you which type of surgery they are proposing to repair your retina, along with the risks and benefits for each type of surgery. What will happen before my surgery? You will have your vision tested and eyes dilated, along with examination by the clinician in the vitreoretinal emergency. They will advise you about your diagnosis and treatment options. You will then have a preoperative assessment with a nursing team to ensure that you are fit for surgery and to identify any health or anesthetic issues that may need action before your surgery. Please remember to bring all of your current medications with you. Following this, you will need to wait until your surgery slot. This is usually in the afternoon. Please be advised that our emergency unit runs a theatre operating list in the afternoon, and it is not always possible to perform surgery for all of our patients on the same day. Should there not be any theatre space, you will be sent home and called in by a clinician when there is space available on the operating list to do your retinal detachment surgery. You will be given an information leaflet and a contact telephone number should you have any issues. What happens during my retinal detachment surgery? First, you will be checked into the operating theatre. Then you will be seen by the anaesthetist, who will explain all anaesthetic options. Most of these surgeries are done under local anaesthetic with mild sedation, which means your eye will go numb and you will be awake but relaxed. You will feel touch and pressure during your operation, but nothing painful. Should you have any particular concerns regarding your anaesthetic, you can discuss these with your anaesthetist before your surgery. We have a range of information leaflets regarding the anaesthetic types, which are available to read in the waiting room before your surgery. After your surgery is complete, you will be taken to the ward for recovery. Relatives can stay in the waiting area until 7 p.m. What about aftercare? In most cases, you will be asked to posture after your surgery. This is to ensure the gas or air bubble floats against the damaged retina in order to support and reattach the retina following your surgery. There are several ways that you may be asked to posture, depending on which area of the retina is detached. Again, you will be advised by your clinician which position you may need to be in and for how long. It is usually 5 days with a break of 10 minutes every hour. You could do face down position over a table using a simple travel cushion to support your head. There are several online face down cushion supports that can be purchased if you Google face down posturing pillow after retinal detachment. You can also posture face down lying down in your bed with the bed mattress pulled down to allow the posture pillow to fit or lie right over the edge of your bed facing downwards. You may be asked to posture in the upright position. You may be asked to posture on your right or left cheek to pillow, or alternating between sides. You can do this either sitting or lying on your bed. It is really important to keep moving during your 10-minute break from your posturing position. This is to ensure you reduce the risk of clots forming and neck and backache. This 10-minute break is also for your food, showering, and bathing. You will have drops within after your surgery, usually to prevent infection and inflammation in your eye. Please ensure you follow the drop regime and wash your hands before and afterwards to avoid infection. What happens to the gas bubble? In time, the gas bubble will reduce in size each day. Your vision will be very blurry when the gas bubble is initially very large, and you may see a spirit level across your vision. Your gas bubble will eventually disappear. Your ward discharge nurse will provide you with a special gas braces that tells you how long the gas bubble will last for. Remember, no flying or high altitude train, car journeys, as sudden changes in air pressure can cause the gas bubble to expand and cause raised intraocular pressure with severe pain and potentially permanent vision loss. Always inform any medical team that you have a gas bubble in your eye should they be considering general anesthesia. Do's and don'ts after your retinal detachment surgery. Do continue to posture as instructed. Use all of the eye drops that have been prescribed for you. Bathe your eye in cool boiled water if it is a little sticky. Discharge in the morning. Keep your planned post-operative appointment. Ensure you move around during your 10-minute posturing break. Come to the accident and emergency if you have severe pain, flashing lights, shadows or curtains across your vision. Don't do strenuous exercise. Rub your eye. Forget to put your eye drops in. Don't work for 2 weeks after your surgery. Don't forget to keep hydrated and eat healthy to promote recovery and well-being. Don't wait if you have a lot of pain or loss of vision. If in doubt, check it out. We hope this video has been informative and has reassured you about your upcoming procedure. Thank you for watching.